All right, and good morning for most of you, and good afternoon for some of us on the call. Welcome to another exciting Fidelis National webinar. Today we have some great partners, but before we go on, I just want to take time to introduce myself and so many people on our team today. I probably won't introduce everyone because there's so many of us, but I'll give you guys a chance to say hello. I'm Jeffrey Humble, your Regional Sales Director here for Fidelis Consultants. We're super excited that you've joined us today, like I said, for another Fidelis National webinar call. Today's topic is one of our favorite partners, if not my favorite partner, Medico cross-selling with Melissa Gwennap. But before we get on the road with Melissa and let you transition and she gives you all her secrets, let me just tell you that we're excited for you to be here with Fidelis. We appreciate your partnership and just want to let you know that at Fidelis Consultants, you are a great part of our agency because you help us stand out, and we want to provide you with the most complete approach to supporting your business. And we have 4 things to do that. Obviously, today is technology. You're on the call, so you got the best part of us. Our technology with Medicare Center, our calls that are nationwide, our training, we do all of these things for you. So just know that we're all about the state of the art technology. Our marketing team, you guys have seen our emails, you've seen our ads on LinkedIn, you've seen our Facebook posts. Big shout out and thank you to our marketing team for making all that happen. They do so many things behind the scenes. Our sales team, obviously, that's a huge part of your success here at Fidelis. We are here for you and all around the country to help you and dedicated for you. And of course, our support. There are so many people behind the scenes at Fidelis that make it happen and keep this thing going every single day, and so many amazing things happening every day. So let's go ahead and start your agent journey today. And like I said, Melissa Gwennap, an amazing partner with us. And if you're not successful without Medico, or I'm sorry, let me say this correctly. If you're successful, then you have Medico in your sales tool belt, right, Melissa?
That's correct, Jeffrey.
All right, looks like people are still joining, but I'll let you go ahead and get us started. I'm excited to see some of the new things that you're bringing to us, and we'll have a good day. And guys,
Awesome.
sorry, just some housekeeping rules real quickly. We will monitor the chat box. All of my team is going to monitor the chat box to make sure that we're answering your questions. We'll probably do those at the end of the call just to make it easier. So if you want to put your question in, we'll hold it. Otherwise, we'll have a Q&A at the end with Melissa. Okay.
All right, everyone. Jeffrey, thank you. Fidelis, thank you so much. We really value your partnership. And agents, you are now part of Medico's partnership, whether you know it or not. So just to kind of get started, my name is Melissa Gwennap. I am a national sales director here at Medico. I promise you are in good hands. I've been here for it'll be 23 years in July. And so my going joke is I started when I was 12, for any of you trying to guess how old I am. Okay. So just really quick, like Jeffrey said, we're going to answer any questions at the end of today's presentation. Just so you guys know, I'm super open. And one of the things that I always like to make sure I point out, no question's a dumb question, because if you're thinking it, maybe I didn't go over it clearly, maybe I totally forgot, which I hope I don't, but you just never know. So again, thank you for taking time out of your busy schedule to attend today. From literally everyone on the Medico sales team, welcome. We're happy to have you on board with us. And by the way, if you're not contracted with Medico, please get with a Fidelis representative and they will help you get contracted. But really during today's presentation, I'm going to go over our ancillary products and why cross-selling is a must, okay? And again, like we said prior, any questions you guys have, please feel free to type those in the chat box, the Q&A box, and we'll go from there. So maybe some of you are on today and you're like, who the heck is Medico? So just to kind of give you an idea, we're a large company backed by the personal service of a small company. We've been in the insurance industry since 1930, so we are not new to this market. We're part of a financially strong and stable organization. We are A, which is an excellent rating through AM Best. Why do I talk about that? Because it's important that Medico will be here for your clients when they're in need at the time of claim. We have a proactive approach to doing business. We have a team of people behind us from the sales department, service teams, underwriting, claims, customer service. I want you to know that all of our employees here at Medico are committed to helping make your job easy and ensure your clients feel respected and informed. All of our underwriting, if you're doing a plan that's underwritten, we're within 2 days. That's phenomenal. And then we've also got some tools that we provide you from electronic quoting, our enrollment system. I will definitely go over all of that with you. But so I'm in the field a lot and I do this in person. But in summary, I always get to hear how easy we are to do business with. Okay. So to me, that's very important. Medico has 2 offices. They're both in the Midwest. I'm along with Jeffrey getting ready to get slammed with a storm, and I think ours is going to be snow, but I'm so excited. I can't wait. I live in Iowa. Okay. And then one of our offices is in Des Moines, Iowa. And the other one, which is only about 20 minutes from me, is in Omaha, Nebraska. So when you call in, you're talking to Midwestern people, and that's important, especially for dealing in the senior market. So before I get talking about our products, because that's really what we want to learn about today, I know you guys all have the availability to raise your hand, I believe. I want to know how many of you have been on a turning 65 appointment and they are so excited because they're now going on Medicare and they absolutely think everything is now going to be covered. Raise your hand if that's happened to you. Should be all of us, right? Me, all of us. Okay. How wrong are they? Medicare does not cover everything. And the first product we're going to touch base on is our dental product here at Medico. Super simple, first day coverage on absolutely everything. The pricing is easy. It doesn't matter how old your client is. And not only do we do Medicare age clients, but on the dental product, Medico, we go down to age 18. So if you have clients who are anywhere between the ages of 18 and 89, they can purchase Medico's dental plan. All of the states in blue is where this product is offered. As you can see, I know Fidelis has a big precedence in New Mexico. Unfortunately, this plan is not in New Mexico, so I'm sorry for any of you that are on. But the other thing that I just want to talk about is how important oral health is to our overall health. So poor oral health is linked to many conditions, one of them being cardiovascular disease, respiratory disease. I just read a study that it's now being linked with Alzheimer's disease. So when you signed up to become an agent, probably a couple things you didn't realize that you now are, okay? You're their HR director. People are, turning 65. They're used to HR just handing them a packet and saying, here's your plans, go ahead and pick it. Guess what, agents? That's now what you get to do, okay? You're also now their teacher. And why are you their teacher? Because you need to educate them what exists in the market. I promise you, your clients have no idea that they can buy standalone dental products. They can buy hospital indemnity. They can buy cancer insurance. They do not know this. So it's your job in the cross-selling portion just to educate them, okay? People that are turning 65 coming into the market today, they're used to having dental coverage, okay? So one of the biggest things that I always tell agents that should be in every single one of your pitches, if it's Medicare base, is do you realize that Medicare doesn't cover dental? Okay. Your clients might look at you like you're crazy, but then that's your opportunity to be able to help them. Okay. So all of the states in blue is where our product is available, and we'll go ahead and talk about those plans. Again, very simple. 2 plan options. One is called Gold. One is called Platinum. Issue ages 18 to 89. Everyone is guaranteed a policy. There's zero underwriting on this plan. First day coverage for everything, including major services. Couple different riders we will talk about after I explain the benefits that your clients can add if they want to. All of our applications are accepted electronically only. We do not do paper applications, and we'll go through that. But we also have a multi-policy discount. As many of you know, Medico also is in the Medicare supplement space. not really talking about that today because I want to really touch on cross-selling and why it's so important for your clients. But we are also in the Medicare supplement space. We're in about, I want to say 30 states for our Medicare supplement. We are very competitive in your urban, suburban areas with an awesome rate stability, okay? Which I always say as an agent, that's important. However, if your client has a Medicare supplement with Medico, or they're purchasing a Medicare supplement, we will give them a multi-policy discount on their gold and platinum plan of 5%. Okay. Why are we doing that? Because oral health is linked to poor overall health issues. So we want to make sure that they're getting their dental taken care of as well. Also on this plan, if you have a spouse in the house, I'm sure you guys have heard that, right? You can also add a spouse to this plan. They do get their own benefits. They do have to pay their own premium, but the spouse will get a 12% discount on this, okay? So let's jump into what these benefits actually look like. So the gold plan, they can purchase either $1,000 that gets paid out per calendar year or $1,500. Platinum is going to be the same. It's either $1,000 per calendar year or $1,500 per calendar year. Now, you may be asking, besides premium difference, what's the only difference on these plans? Do you guys see this basic service down here? This is the only difference besides premium between gold and platinum. So we'll go through that, okay? So preventative services, what you and I go to the dentist for every 6 months to a year, our normal evaluations, our cleanings, and our yearly x-rays. That's what we call preventative. On this plan, there's no deductible for preventative. Medico does pay 100% of their preventative service. There's no waiting period. So if somebody buys a policy tomorrow, they can have a cleaning the next day. Okay. So no waiting period on anything. Okay. And then we pay 100% of 2 cleanings per calendar year. Now that does go towards the $1,000 or $1,500 maximum. Basic services. What's a basic service? Have any of you woke up with a toothache before? It's miserable, right? So you wake up, your tooth's killing you, you call the doctor. First thing they do is they do an exam, they look in your mouth, and then they do an x-ray to see what the heck's going on, right? So a basic service is a diagnostic x-ray. Maybe shame on me, I had a cavity and I need a filling, okay? That is a basic service. Also, a non-surgical extraction. And what does that mean? That is a tooth above the gums that they just pull out non-surgical. Okay, so on gold, after a $50 deductible, we will pay 50% of their basic service, again, up to that $1,000 or $1,500. Guys, just to give you a secret, for less than $4 a month, if they purchase platinum, they get 80% coverage on basic services, okay? So 80% on that basic service up to the $1,000 or $1,500. Major services, guys, there's no waiting period. They purchase a policy today, they can have a major service done tomorrow. So what are major services? I always say this is stuff I do not want to ever go to the dentist for, right? Root canals, crowns, bridges, dentures, dental implants are covered on this plan, and periodontal services. Now you'll see here on the slide, within the first 12 months, if somebody needs a major service, Medico will just pay 20%. But I promise you 20% on a major service is better than a big fat zero, right? So, and then after they've had the plan for 12 months, Medico will pay 50%, okay, on both gold and platinum. So let's talk about pricing, and then we'll talk about some riders that they can purchase. So the gold 1000 policy, and remember, it doesn't matter if they're 18, they're 45, they're 65, or they're 89. It doesn't matter if they live in Iowa, they live in Kentucky, they live in Texas. Doesn't matter where they live. All of the pricing is exactly the same. So the gold 1000 is $36.80 a month. The gold 1500 is $46 even. So gold 1000 is $36.80 a month. 1500 is $46 a month. Platinum 1000 is $39.79 a month. And then platinum 1500 is going to be $49.78 a month. So basically anywhere between $36 to $50 a month, they can have day one coverage on absolutely everything dental related. Okay. Couple different riders. And PS, we don't coordinate benefits. Okay. So your clients can have this policy. Maybe they're on a Medicare Advantage. I own this policy. Okay. My husband works for the Iowa Department of Transportation. We have insurance through his employer, but I also own this policy. Okay. Agents, I always say, you are your best customer. How can you sell something if you don't know how the policy looks like or you own it? Okay. So I own this plan. So the first rider is going to be a buy-up benefit rider. And what the buy-up benefit rider states is we will add $1,000 worth of coverage every single calendar year. So this policy runs from January 1st of a year to December 31st of the year. Okay. And then it starts over the following January 1st. So what this does is it adds $1,000 worth of coverage. So if somebody buys a $1,500 policy, plus they buy the buy-up benefit, they have $2,500 worth of coverage every single calendar year. This rider costs $11.95 extra a month. Okay. But they can get that extra $1,000 every single January 1st. The next rider, just to give you an idea, we sell 70% of the time. And this is where we really differ in the market. Okay, so this rider is what we call the buy-up or the rollover benefit. And what the rollover benefit does is it allows your client to roll over any unused benefits from year to year to year. Okay, so to give you an idea, I have a $1,500 policy. Last year, thankfully, knock on wood, I only had 2 cleanings that I had to have done. Okay. So with the 2 cleanings that I had to have done, I got to roll over like $1,200. So now I got my new $1,500, plus now I have $1,200 of rollover money. So if something major happens, I've got some extra cash. Okay. So it rolls over from year to year to year up to a total of $3,000 in rollover money. This rider, I always say, is like Walmart pricing. It's $7.97 a month. So very inexpensive. And it's great if people know down the road they're going to need some major services done because they can just keep rolling. Okay. Now your clients do have the freedom to go wherever they want. Oh, really quick, let's go back to those riders because I know this will be a question. They can only buy one or the other rider. They can't buy both. And then they are always done. The rider has to be purchased at the time of application. So a client can't buy the policy and then decide later they want to add the rider. That's not how it works.
Hey, Melissa, sorry.
Yeah.
I didn't want to interrupt you, but sorry. The slides, I think they're a little bit delayed with our internet service.
Oh, so what are we on?
It's that snowstorm. We're still on 10. Sorry, I was trying to find the right moment to interrupt, but we're still on.
No, slide. That is okay. That is the right slide. I was just talking about the riders. I don't actually have a slide on the riders.
Okay, just kidding.
Yes, but what I will do is at the end, I will send over a copy of the PowerPoint slides so you guys can share them with everybody. And I will send every single highlight sheet for the products that we're talking about today. So you can share that with all the agents who are on.
Awesome. Okay. And guys, we will email that to you after the call. Our marketing team already has some great stuff to share with you.
Yay. So yeah, sorry about that. I just don't have a slide on that. So really quick, your clients can go anywhere they want. We do not care. Medico pays the claims no matter if they use a network dentist or they do not use a network dentist. So our network that we use is called Zealous. It's similar to the Carrington network. So we just actually did this new network this year. And the reason we did it is they have a little bit better discounts for the clients and they have a larger base as far as dentists go. There's over 500,000 dentists in this network. Okay. So it's called Zealous. If your client gets the policy or you purchase the policy, you get all the information. Again, the client does not have to use that provider. The only benefit of using a network provider is they may get a discounted service, a discounted fee at the time of service. Okay. Medico does not care. I will give you an idea. My dentist is not in the network and I didn't get paid any less if I was using a network doctor. So It goes on reasonable and customary. And believe me, every single dentist knows what reasonable and customary is in their area. I promise. Okay. So also what we've added new this year is because we got a lot of people saying, well, what if somebody wants vision or somebody wants hearing? So what we did is we went ahead and partnered with VSP, which is a vision plan, and Start Hearing, which is a hearing plan. If your clients are interested in this, the hearing part is free. It doesn't cost them anything. They can go, once they get their policy, they'll get an email, they can go on and sign up for the hearing portion, and then they can also sign up for VSP. VSP is not free, and there's some different plans that they can choose from, but basically what it does is it helps pay for glasses and contact lenses and frames. Okay, so they do have the option if that's holding them back from buying Medico, just so you guys know. All right, shall we talk about hospital indemnity? How many of us on this line sell Medicare Advantage? Raise your hand. I always like to know my audience. So far, I've only seen one person raise their hand. Jeffrey, is that true?
No, I think they're like me. They're trying to figure out where that hand button is. We've got some amazing agent partners on this call that sell a ton of Medicare Advantage. So
Okay.
I will vouch for every single one of them.
Okay, perfect. So I'm like, I highly doubt one person sells Medicare Advantage on this call, but maybe. Okay. So since it sounds like you guys don't know where the raise hand button is, and I'm not really sure because I'm in presenter mode, so I can't even really tell you where it's at either. So I'm just gonna pretend that I have fake hands raising. Okay. So then my next question is, how many of us cross-sold a hospital indemnity plan? I'm gonna say half of us are. Cindy, you're on it. You know how to raise your hand. Good job, girl. Okay. And good job on cross-selling. So I'm just gonna pretend that half of us on this line actually cross-sold a hospital indemnity. So really quick, I just want to touch base on hospital indemnity and how important it is to your clients, and especially your Medicare Advantage clients. So we've all heard that clients come to us, and Jeffrey, you can spit this out if you want. You know me, I'm super open and fun. But clients come to us and they want Medicare Advantage for one simple reason. What's that reason, Jeffrey?
Easy, convenient, cost. I mean, there's a million reasons.
Correct. Most of the time it's cost, okay? Because it's usually $0 premium or a very low dollar premium, okay? And they don't want a Medicare supplement because they can't afford a Medicare supplement. Well, a client cannot afford a Medicare Advantage plan without some sort of hospital indemnity attached to it, okay? So statistics say that our retired family, so a 65-year-old couple, only has about $6,000 in what I call go-to savings, okay? Go-to savings isn't for a hospital stay. I promise you that. What go-to savings is maybe a winter rental. Okay, maybe they're snowbirds. Maybe it's to take their family on a vacation, Christmas money for their grandkids. I promise you, if you look at your clients and they're on Medicare Advantage and you're comparing what all of their out-of-pockets are, and you look at them and you say, okay, do you have all of your money, all of this money in your savings account saved in the event you have to go to a hospital, in the event you have cancer? They're going to look at you like you're crazy, okay? Because they do not. They don't have it saved, I promise you. And how do I know that? Because we did a study, and there was over 2,000 adults nationwide, okay? 44% of those adults had to set up payment plans, okay? 42% of those adults had to, I'm trying to think of what that statistic said. Anyway, it wasn't good. And 7% had to file medical bankruptcy because of unexpected healthcare stays or hospital stays. And when we're dealing with the 65 plus market, guys, you all have heard this. It's not about if they're going to go to the hospital, it's when and how many times. So what I'm going to tell you is if you're presenting a Medicare Advantage plan, and you're not presenting a hospital indemnity right after that, you're doing your client a huge disservice. And I promise you, when Joe calls on the phone and wants to sell them a new Medicare Advantage plan, they're going to go with Joe over the phone and not Jeffrey. Okay, so you need to be cross-selling because A, it's important for client retention, and B, you don't want to do your customer a disservice. And by the way, guys, if you're not cross-selling, you're leaving a lot of money on the table for yourself. Okay, so really quick, all of the states in blue is where we offer our hospital indemnity product. And again, this is just not for your Medicare market. This is anyone between the ages of 18 and 85. Okay, so maybe it's somebody who doesn't have insurance at all. Maybe it's somebody like me who bought the policy in the event something happens. Okay, this premium is so inexpensive and we will go over the cost of it. But just to give you an idea, so I'm 42 and I own this policy. Plus I have a couple riders and I'll kind of tell you what riders I have. My premium is $13.97 a month. Okay, that's less than a Jimmy John's sandwich value meal these days, right? So again, anyone you can market ages 18 to 85. Also, if you have a client who lives with another individual over the age of 18, they automatically qualify for a 7% household discount. That person does not need to be applying, okay? So all of the benefits on this screen is the base plan. The very first benefit is the inpatient hospital confinement benefit. This is the only thing that you and the client need to figure out how many days they want Medico to pay and how much money do they want Medico to pay. The other 4 benefits that you see, the observation, emergency room, inpatient mental health, and transportation and lodging, is automatically included in the base plan. Okay, so they automatically get that no matter what. So the very first benefit is inpatient hospital confinement. So where I'm from Iowa, okay? And our Medicare Advantage plans here, we have to pay $325 a day for the first 5 days that we're in the hospital, okay? I don't know about you guys, but I'm getting ready to go to Cabo. And if I'm paying $325 a day to be somewhere, it better not be the hospital. It better be on a beach somewhere with a cocktail in my hand, right? Nobody wants to pay $325 a day for the first 5 days while they're in the hospital. I promise you that, okay? And once you cross-sell them and you tell them, don't worry about that though, because you guys should all be talking about their out-of-pocket expense while you're going through their Medicare Advantage. Don't worry about that cost. I've got a very inexpensive policy that I will show you, and I highly recommend you purchase, okay? Don't forget, you're the teacher, you're the driver, you know more what your client needs than what they need, right? So inpatient hospital confinement, Medico will pay anywhere between $100 a day to $600 per day, and you can increase that in $25 increments. So if you want to do $325, $350, $375, $400, whatever you want to do, you could absolutely do that. Medico pays days 1 of inpatient hospital confinement. So we always pay day 1. Now your client chooses. Do they want Medico to pay for 3 days while they're in the hospital, 6 days while they're in the hospital, 7, 8, 9, 10, 21, and 31. Right now with a senior, the average hospital stay is anywhere from 3 to 5 days. Okay. So you, again, talk to your client, you look at pricing, maybe they have a budget, and you go from there. Okay. Observation. This is automatically built in the base plan. How many of you had this issue between your clients and Medicare? It's been a huge thing. Okay. So it's a problem between the hospitals and Medicare and being readmitted. And if they put them in an observation, they get a better score, blah, blah, blah. But the only one who suffers is the client. Okay. Not with Medico. because if they're put in observation, Medico pays 100% of the inpatient benefit up to 6 observation days per calendar year. We have an awesome competitor whom I love, the reps, okay? But they do have a requirement of hours they have to be in observation. Medico does not, okay? We don't care if they're there for 2 hours or they're there for 6 days. We do not care, okay? Emergency room benefit. If your client has to go to the emergency room, we will pay $150 per day, up to 4 emergency room visits per calendar year. They do not have to be admitted to get paid, but it does have to be due to accident or injury, okay? Inpatient mental health, we all hear this is on a rise. I live with teenagers, so sometimes I think I need to check myself in for a break, okay? So what this plan pays is $175 per day, up to 7 days per calendar year. Transportation and lodging, everyone forgets about this benefit. How do I know that? Because we hardly have any claims on it. But this is awesome benefit, especially if you're in rural areas. What this says is if your client has to travel more than 50 miles from their residence to receive inpatient treatment, we pay an additional $100 each day they're in the hospital, up to 10 days per calendar year. That is $1,000 benefit built in the base plan. What do they do with this money? They can stick it in their pocket for all we care, okay? This policy pays a tax-free benefit directly to your client, or we can pay the provider if they want us to, but I will tell you 99% of the time, the check goes immediately to the client. This is everything on this policy, just not transportation and lodging, okay? So what does it pay for? Maybe a loved one's hotel fee, parking garage fees, food money, gas money. Medico does not care, okay? So all 5 benefits built in the base plan. Remember these when we talk about pricing. And then the inpatient portion also has a restoration of benefits, okay? What the heck is restoration of benefits? So on the inpatient portion, when your client goes into the hospital, we have lovely Jane here. She chose a 6-day option. She was in the hospital for 5 days and then she was discharged. She went 60 days out of the hospital. Guess what Medico does on day 60 out of the hospital? We reset that full benefit back to them. So in a not so perfect world, your client can use the inpatient benefit up to 6 times per calendar year. So it's just not a 1 inpatient stay and done. It can be up to 6 times per calendar year, okay? Clear as mud so far? Perfect. All right. So let's talk about the riders. I know I'm jamming your brains and I'm sorry, but there's 7 different riders that your clients can also choose from. Now, is every client going to buy every rider? No, they're not. And that's okay. But what's not okay is we're not talking about them. Okay. Or we're not talking about this plan in general. So the first rider is Medico's #1 sold rider, guys. It's less than a Starbucks coffee, okay? It's the ambulance rider. So if your client has to go in an ambulance, Medico will pay $250 per ambulance ride, up to 4 rides per calendar year. There is a lifetime maximum of 10 ambulance rides. If a client gets 10 ambulance rides out of Medico, we cancel the rider and we no longer charge them the $3.20 premium, okay? Outpatient therapy and chiropractic service benefit rider. I call this the buy one, get one free rider. The buy one portion is outpatient therapy. It does have to be in an outpatient setting. This does not include inpatient or in-home healthcare. Has to be outpatient. It's for speech therapy, occupational therapy, physical therapy. What Medico does is we pay $50 per therapy visit, up to either 15 or 30 visits. I'm going to fill you in on a secret. Sell 30. It's less than 80 cents a month more for 15 additional days. Okay. And then if you're like me or your clients like me and they go to the chiropractor, Medico pays them 5 chiropractic visits. Okay. Up to $50 per visit. So $50 for 5 chiropractic visits. We don't care what the visit's for. If it's maintenance, if it's a new injury, we don't care. Okay. Outpatient surgery benefit rider. I own this rider. Okay. We pay for 2 outpatient surgeries each calendar year. Now, what we pay is up to the client. Is it $250, $500, $750, or $1,000? My husband had outpatient gallbladder surgery last year, and we had the rider, and it paid. Okay, paid us. It helped us pay our deductible. Skilled nursing. We all hear that this cost is on a rise. Medico pays days 1 through 50. Yes, agents, I know you're going to say, well, Medicare pays the first 20 days. We don't care. So do we. Okay. So we pay days 1 through 50. What we pay is up to the client. Is at 100, 150, or 200 per day. Lump sum cancer rider. I also own this. Okay. And I could go on and on and on about this rider, but I won't. Okay. Because one thing as insurance agents, we were never taught how important it is for our clients to have cancer coverage. Okay. Cancer doesn't care how old we are. Cancer doesn't care what we've got going on. It doesn't care if we're on a Medicare Advantage plan and we have to pay 20% chemotherapy. Okay. It does not care. If you're selling Medicare Advantage, this rider should be sold every single time. For the simple fact, if they have to have chemotherapy, they're responsible for 20%. Okay. This is a tax-free lump sum check that gets paid to your client if they're ever diagnosed with internal cancer or malignant melanoma. I personally own $10,000, and that's probably not even enough. Okay. So $10,000. If you have to go through underwriting, which we'll talk about in a couple screens, we only ask about cancer diagnosis or treatment in the last year. I use my mom as an example. She's a 2-time breast cancer survivor. She's coming up on 6 years cancer-free. She can buy this rider. Okay. Urgent care never fails at my house. Somebody's sick as soon as the doctor's office closes, right? And in all the big cities, there's urgent cares on every corner. They're in our CVS's, they're in our supermarkets, they're everywhere. If your client has this rider, Medico will pay $50 per urgent care visit, up to 4 visits per calendar year. Lump sum hospital confinement benefit rider. This is just additional cash that your client receives if they go inpatient into the hospital. What does this help pay for? Maybe they have a dog at home, or they have animals at home that someone has to take care of. Maybe it's snowing and they live in a residence area where they have to have snow removed. Well, if you're in the hospital, you can't really do that, right? So this is just extra cash that goes into the client's pocket. It's up to either $250, $500, or $750. Told you I was going to talk about pricing. So I'm going to do that first, and then next we're going to talk about underwriting, okay? Because it's simple. So remember the base plan? It covers inpatient hospital confinement, 100% observation, 4 emergency room visits, inpatient mental health, and transportation and lodging. This, my friend, is the price of a 65-year-old female with a household discount of that 7%. They go into the hospital. Medico is going to pay $250 a day for 6 days, plus they get all of those 4 benefits. Guys, for $13.39 a month. Have any of you been through Jimmy John's drive-thru? I'm going to pretend that some of you raised your hand. Okay. You can't buy a sandwich, a soda, and chips for $13.39. Okay. Ambulance rider, told you, is less than a Starbucks coffee, $3.20. You guys can all read this price. The lump sum cancer benefit, a $5,000 payout for less than a McDonald's value meal, which is probably given us the cancer, right? $9. So basically your client can have the base plan with every single rider for $55 a month. Now with a Medicare Advantage plan that they're paying $0 for, or very low premium, paired with a hospital indemnity, is basically coverage of a Medicare supplement for a fraction of the cost. Okay, so think about that. And like I said, not every client's going to buy every single rider. They're not, and that's okay. They don't have to, but you have to talk about this plan. Okay. Underwriting. There are 9 knockout health questions, but first let's talk about what Medico did June 1st of 2022, because some of you on this line probably don't know, okay? We came out and we said, we are going to give everybody a policy, no health questions asked, for anyone between the ages of 64 and 67. So any of your Medicare clients between that age do not have to answer any health questions. Any of your clients, period, between 64 and 67, no one has to answer health questions. Everybody gets a policy, okay? With that being said, there is a 6-month pre-existing condition limitation, and that's even on if they have to answer health questions. So I use myself as an example. I have asthma. I've had it since I was a child. When I bought my hospital indemnity plan, if I went into the hospital within the first 6 months or had to have therapy or anything due to asthma, they would not cover me. After 6 months, I'm golden. They will cover me as many times as I need to be covered. Okay, so the same applies for your clients. Now, if your client's at Walmart, they fall down, they break an ankle, they break a hip, they're covered because that's not pre-existing. Okay, clear as mud? So
Melissa,
guarantee issue. Yeah, go ahead.
one question for you. I know we said we were going to wait, but I wanted to throw this in there for you. Tracy was asking, can a member purchase this if they're currently in a skilled nursing facility? And we can throw this into our simplified underwriting part.
Absolutely. So if they're between the ages of 64 and 67, absolutely they can. If they're outside of that range, they cannot, because there's 9 knockout health questions. And one of them asks, in the last 3 months, have they been in the hospital, rehab, skilled nursing, assisted living? Okay. So if they're between 64 and 67, absolutely they can. Okay. So, but if they're between ages 18 to 63 and 68 to 85, the answer is no. So there's 9 knockout health questions for clients between 18 and 63 and 68 to 85. The very first question on the application I always giggle about, because if you're dealing with a male client or you're dealing with a senior, right? The very first question is, are you pregnant or undergoing infertility treatment? So, and yes, you have to ask it, even if you're sitting across the table from a male or from somebody who's 65 years old. Everyone laughs. I promise it's an icebreaker. Okay. It's not awkward. It might seem awkward, but everybody laughs. So this is a short application. There's no telephone interview, no medical exam, no prescription drug screen. These are simple yes or no health questions. If they answer yes to any of these questions, they do not qualify if they're in the underwriting stage. Okay. So in the past 12 months, have they used oxygen? Have they been treated for COPD, MS, Parkinson's, or Alzheimer's in the last 12 months? Are they somebody who's a diabetic that takes more than 50 units of insulin? So something Medico did brand new is on this plan, we're now taking people that are insulin dependent. Okay. So if they're not taking more than 50 units, they qualify. If they are taking more than 50 units, they do not qualify. Or if they're taking more than 3 oral diabetic medications, they do not qualify. Okay. Have they been diagnosed with heart attack, stroke, cancer? This applies to that cancer rider as well. Okay. Are they currently on dialysis treatment? So with that being said, this is pretty much what those questions look like. There is one that asks, like I said, in the last 3 months, have they been hospitalized, confined to a nursing home, assisted living? That is on there if they have to go through medical underwriting. So I already talked about 6-month pre-existing limitation. That applies for anybody who is non-underwritten and an underwritten case. Okay. But one thing I want to talk about on the underwriting side, because I don't want you guys to ever be surprised by this. And it doesn't happen very often, but lo and behold, sometimes we do have it happen. So our clients always tell us the truth about their health, right? Okay, let's all laugh because that's a joke. They do not. Okay, so they don't always tell us what's going on. Couple reasons. A, they might not want us to know, and B, they might be in denial. So we do have a 2-year contestability. So let's say you have a client who's been diagnosed with COPD. You do the application and they say, you know what, Jeffrey, I don't have COPD, but I'm dealing with asthma and I'm taking an inhaler, and that's fine because asthma is not a knockout. Your client files a claim within the first 2 years of having a hospital indemnity policy. Medico finds out there was pre-existing COPD before the policy was issued. We will resend the policy. However, we do refund 100% of their premium. I just want you guys to know that can happen. And I also want you to know that our clients don't always tell us the truth. Okay.
And Melissa, I've got
Yeah.
one more
Oh,
question
yeah.
from another agent, and I actually shared this health thing with that agent. So it's kind of, it brings it more personal to see that we're real people and these things apply to us. But let's just
Absolutely.
say I had my heart attack in October, because
Yeah.
obviously I didn't, and this agent had theirs pretty close as well.
Mhm.
We're heart attack buddies. That's probably not a funny joke, but we'll try.
Hey,
Um,
you got to make the best of it.
exactly. Silver lining, y'all.
Yes.
When can I pick up a Medico policy? Because obviously I'm not in that 64 and up range, but when can I pick up a Medico policy based on my heart attack in October of
Yep.
2020?
So it's going to have to be 12 months from the time you had a heart attack.
Okay. Everyone,
Okay.
12 months. I just want you to know, just because it's a no for Medico now, based on the underwriting, do not discredit or discount them, rather. Let me say that correctly, or if that even makes sense, because they can always get a policy later on.
Yep. And I remember Jeffrey telling me he was kicking himself when this all went down, weren't you, Jeffrey?
And that's another reason why I'm bringing this up, because I've not even sat down and figured out what my payout at the slot machine of Medico would have been.
You probably don't want to know because then you're really going to kick yourself that you didn't have it, right? So remember when I said you guys are your own best clients? I'm not joking. You are. You know how the policy works. You know who the company is. You literally know everything about it, right? So don't wait until it's too late and don't do the same with your clients, okay? Make sure you're talking to your clients about these products. They're simple, they're easy, and guys, it's going to pay you some pretty good commission, and we've got some really good bonus money going on right now. Okay. So the last thing I want to talk about before I leave you guys, and I know I've probably taken a little bit more than I should, but I wanted to make sure that you guys clearly understand and you understand why it's so important. So Medico, kind of like the hospital indemnity cancer rider we talked about, we also have a standalone policy. The standalone policy is different in a couple ways, okay? It's more money than what the rider is. And we do have a 10-year look back. But like I told you, as insurance agents, we're not told that everybody needs cancer insurance, right? There's no class that says, hey, congratulations, you got your license. Congratulations, you passed your AHIP test, one of the hardest tests you'll probably ever do in your life, right? But by the way, make sure you talk to your clients about cancer insurance because cancer statistics are insane. Nobody tells us that, okay? So I'm telling you that. So what this plan does is it pays $10,000, $15,000, $20,000, $25,000 lump sum, tax-free, okay, if they're ever diagnosed with internal cancer or malignant melanoma. There's 3 simple health questions. Oh, I think I'm writing on the slide. Am I writing on the slide? Is that me? Okay, I don't know what happened. Anyway. So there's 3 simple health questions. We don't ask about tobacco, which is a shocker, right? We don't ask about family history. And the big thing right now, we don't ask about genetic testing. I was actually just with a group of agents and there was probably 600 of them. Okay. And one of the very first things one of them said to me is, I need to be genetic tested because my family carries the BRCA gene for breast cancer. If I do that and I'm BRCA positive, I then cannot be insured. That's incorrect. That person can still be insured with Medico. We don't ask that. Okay. All we ask about is 10-year look back. So have you been diagnosed with cancer or malignant internal cancer or malignant melanoma in the last 10 years? That's all we care about. Okay. All of the states in blue is where this product is offered. If you have people in the same house buying this, they do get a 10% discount. I will tell you 10,000 about a 65-year-old female is about $10 a month. So again, very inexpensive compared to what a cancer diagnosis will cost somebody.
And
What
hey,
I like
Melissa,
to talk about, yeah.
sorry to interrupt you again.
No.
One quick question. So obviously we have some gray there. So this is for the standalone first diagnosis cancer policy. When
Correct.
it comes to the rider, is the rider available in, for example, states like Colorado where it's the rider and not the standalone?
It is. It
Okay.
absolutely is.
So guys, that's extremely important. Not to steal Melissa's thunder, and I apologize for interrupting you.
No, I'm glad.
Tracy, you had the question about the cancer policy rider being available in Colorado. The rider is
It is
available in
available.
Colorado and all those
Yes.
other, well, possibly those other states. Melissa can answer that, but it's still an option to sell them the rider, whereas this one's not.
Right. Correct.
Thank
And the
you.
reason being is Colorado asked us to pull this off the market. I don't know why. It happened a few years back and we had to pull it. So we're at the mercy of all the insurance departments, okay? So again, this product's available in 30 states. By the way, they can have the hospital indemnity rider for cancer and this policy together, okay? That's doable. So really quick before we wrap up, Medico really makes it easy to do business with. I know there's a lot of carriers in the market, but literally guys, you should consider doing business with Medico. You now have access to me. Okay. I'm on the sales team. You have access to me, but you also have a team of agent services. And I don't know if any of you guys have ever had to call this number. They are super helpful. They help you immediately, and they honestly can help you with anything you need. So the agent services phone number is 1-800-547-2401, option 3. So also, once you're a Medico agent, you have access to our Medico agent website. Literally everything you need is on here. Products, materials, marketing materials, there's videos recorded, commissions, policyholder reports, literally everything you need is out here. So at the beginning of the webinar, I told you Medico only accepts applications electronically, but we use what's called MyEnroller. Guys, it is so simple. It is web-based. You can do this with any device that has internet, okay? It's apply.myenroller.com. It literally takes you less than 5 minutes to do an application. You can sell your clients over the phone with this application. You can do a voice authorization. If your clients are present, you just mark that they're present. It is that simple. If you have not used this, obviously you've not sold a Medico. So if you guys have got questions with it, we honestly can help you. Medico also created a consumer app. So your policyholders now have access to an app that has access to all of their ID cards. They can file a claim. Guys, on my dental, when I had my cleaning, I went to the app and I put dental. I had to sign in, clicked on my dental, hit file a claim, took a picture of the EOB from my primary insurance, submitted it. I got a check from Medico in 10 days. That's how easy it is. Okay. They can find providers. The best part about it, guys, they can find all your contact information if they forgot who their agent was. Hopefully that never happens to you. But in case they do, they can also contact you. So sometimes I know it feels like we do this stuff for free. I really do. Okay. But one last thing I want to talk about really quick is the incentive that we've got going on. So if you're cross-selling, which all of us should be cross-selling, right, Jeffrey? If you're cross-selling the dental product we talked about, the hospital indemnity product we talked about, and the cancer product we talked about, we're going to pay you to do so. All you have to do is hit a minimum of 5 applications. It doesn't matter how you get there. It can be a combo of all apps. It can be the same apps. We don't care. Once you hit 5, we go back to the first app and pay you for $50 per each application, up to 14. Think about everybody you touched during AEP that you can go back to and talk to this about, okay? You should probably hit 15 very easy. So 15 plus applications, this is in addition to your commissions. We're gonna pay you $75 per application, okay? That's a lot of money to be cross-selling. We talked a little bit about Medicare supplement. Medico's got a very competitive Medicare supplement. If you're writing Medico's Medicare supplements also through the end of March, we're paying you $125 per each underwritten application once you hit 5. And then we're also paying $25 for open enrollment and guarantee issue. So again, another opportunity just to make some extra cash. Thank you. I appreciate it. I know it's not easy to find time to jump on these things, but it is so important to make sure that you've got Medico in your portfolio so your clients don't get huge bills after the fact, right? This is my personal cell phone number. You can call me, you can text me. This is my email. You can email me. I do travel a lot. I live in Iowa, but I'm not here very often. But if you try to call me and you leave me a voicemail, I promise you I will get back to you. If you text me, I promise you I will get back to you. Okay. One of the things that I always leave all of my agents with, and this is super important to me, I've been doing this a very long time. Your success is my success. And if you're not successful, that means I'm doing something wrong. So don't hesitate to contact me with anything that you might need. And obviously you've got a great team at Fidelis and they know a lot about Medico. Thank you, Jeffrey. I appreciate your relationship and our friendship. So if there's questions, I'm open. Anything you guys want to know.
We appreciate you immensely as well. I did have a question, so maybe you can test me on this because I cannot remember if it's 15,000 or 10,000, so don't quote me. But on the cancer rider, what was the max that you can get on that?
10,000.
10,000. Okay, just kidding, guys. It's going to be $15,000 someday, but we'll go with 10,000. Oh, Kelly, to
Make a new product up.
Awesome. And guys, Melissa is here for us. Like she said before, she's going to send out this PowerPoint. If you need to deal with one of the sales directors individually, like I said, no matter where you are, our dedicated team of sales directors can help you. We're all over the country. We're very, very busy today because some of us weren't able to make the call, but just know that if you have questions, reach out to any of us and we'll definitely get this PowerPoint to you as well. And Melissa, do you care to go back to those slides with the extra cash on there for just one?
Absolutely.
Guys, you have until March 31st, that's next month, to take advantage of these. I think it's both of them. Okay. So that's just extra cash for doing things for your clients. You should already be reaching out to those clients to check to see how they're doing. Have they done their preventive screenings? Did they get their card? Do they have any hiccups? Do they have any family members that have questions or concerns about what they signed up? You know, that's your way to ask for a nice little referral. And Melissa is here at any time to answer questions, and so are we. And I can't stress to you enough on a personal note, if you haven't bought a policy for yourself, don't be like Jeffrey, buy a policy for yourself because you're doing something for you.
Absolutely.
And anybody have any questions, you can either type it in the text box or you can come off of mute. And I hear crickets, so I'm going to
have 3 minutes to spare, Jeffrey.
You did an amazing job as usual. So if you guys have any questions later on after the call, once you're reviewing those PowerPoints, just reach out to us. Once again, we appreciate your partnership, everyone, and have a good rest of your February 22nd.
Thank you guys so much. I appreciate it. We'll talk soon.
Thank you.
Thank you.